Okay, good evening. Can everybody hear me okay? I'm going to call to order the August 16th, 2021 regular meeting of the Haywood County Board of Commissioners. Our first order of business will be our Pledge of Allegiance, and after that we'll have our invocation. So if everyone please stand for the pledge.
Let's pray. God in heaven, we thank you for another beautiful day that we get to come together as a community and be able to make decisions to help in the areas that we live in our life. We pray for your guidance and your wisdom as we always do. I pray for our commissioners and their task that's ahead of them. I pray for all the thought and the planning that goes into our county and the things that keep us safe and the measures that are taking place to make this the best place in the world to live. And I pray that would continue to happen. I also ask that you would give each one of us as community members guidance and wisdom as to how to live out our lives on a daily matter. We are all in just an unknowing state with all this COVID stuff, and we ask that you would just take control of this and take this away, especially here in Haywood County. We pray for all the many things that are happening around the world. We pray for your continued guidance and protection. And all this we pray in your name. Amen.
Thank you, Pastor Josh. Our next order is their public comment session. Citizens can, I've got a couple of people signed up to speak, and when you have 3 minutes to speak, and if you would, whenever you hear the signal, just if you would finish your comments. And I think Kirk wanted to make a comment before the public comment in case there might be public comments about this issue.
We've received, or I have received, several emails in regards to Richard Bates and his purchase of the property out at 276, and there's some idea or rumors that he was going to use that as a place to allow the homeless to take showers and wash their clothes and things like that. And what I want to do is just make sure. I spoke with Mr. Bates, he's a client of mine, and asked him if it was okay if I speak to the public about this, but he has absolutely no intention of utilizing that spot for homeless or showers or a place to wash people's clothes. It is actually going to be used as a dealership showroom for automobiles. So if there's anyone here, I mean, you're more than welcome to certainly make public comment, but I want to put that to rest because it has been an issue within the community. I think that he's even, the paper's probably spoken to him because we know how things start and get rolling. But I spoke with him, and he absolutely has no intention of doing that. So,
okay,
just want to make that sure people knew that before public comment.
Okay, and I know Mr. Bates, and I think if everybody knew, he's really helped a lot of nonprofits in our community. I think if everybody knew how much help he's really helped people, unfortunately, there's been some negative press about him, but he's really helped a lot of people and a lot of organizations in our county, and I'm very appreciative of that. Okay, so we'll move on to public comment, and our first person to sign up to speak is Janet Presson. Welcome, Janet.
Thank you. Good afternoon. I'm Janet Presson. I'm an RN who lives here in Haywood County, and I want to talk about the pandemic, of course. I attended the Haywood County School Board meeting this last Monday night and came away just astounded by the level of fear some of our citizens have regarding COVID. There was literally another RN who called children murderers if they spread COVID by not wearing a mask. She left before I had a chance to speak to her, but I've seen this fear and anger from others as well. I've been told that those of us who refuse to mask and or decline the still experimental vaccines should not be allowed to work, enter businesses and restaurants, attend events, and should be turned away if we need medical care. Think about that. These are some of our friends and neighbors here in Haywood County saying these things. Governor Cooper's hard at work on a vaccine passport that I'm sure will cost millions and do nothing but further divide us. Recovery rates for COVID are still about 99.6% for those under 70, about 95 to 96% for those over 70, and 99.999% for children. This virus has been and continues to be hyped as a virtual death sentence by the media, Dr. Fauci, many of our legislators, the CDC, and our state and local health departments. This must stop. The psychological damage being done is incalculable. The fear, the division, and the hatred. I mean, it's just mind-boggling. Dr. Javen and our health department folks keep telling us to mask up, get vaccinated, and socially distance. None of these options have been particularly effective. I'll still debate anybody on the science of masks, but we don't have time here, obviously. The CDC has stated now that the vaccines do not prevent the virus, nor do they keep recipients from spreading the virus. And I'll repeat that. The CDC has stated that the vaccines do not prevent the virus, nor do they keep recipients from spreading the virus, all while telling you that they should be mandatory and that boosters are coming. And that's from the CDC. Dr. Jabin needs to throw away his simmering pot and replace it with a slow, calm crock pot. I'm challenging our health department to start telling everybody the other options available to prevent and or treat COVID. We need to be hearing these things in the newspaper and in the press. There's more and more research every week showing that vitamin D, zinc, ivermectin, hydroxychloroquine, Regeneron, and other options work. In California, doctors are using sub-Q monoclonal antibodies outpatient. I don't know if any of that's available here. We need to be hearing that. What options do we have? What are the physicians at the ER and the ICU doing? The ICU RN that was so distraught at the school board meeting was yelling about remdesivir and ventilators being used in her ICU, both of which are pretty ineffective. I'm not telling anybody how to treat a COVID patient. I'm saying we need to empower people and calm them down. Psychological health is critically important, and we just aren't recognizing or addressing that here. Again, suicides have skyrocketed. Drug and alcohol use has skyrocketed over the last year and a half. We've got to recognize those as the killers they are as well. Thank you.
Okay, thank you, Janet. Okay, our next person that signed up to speak is Kay Miller. Welcome, Kay.
Thank you. It's good to be here, see everybody. I want to ask you to please side with liberty and individual choice, not mandates and government overreach. Please end the mask mandates in county buildings. Remember what John Adams said, liberty must at all hazards be supported. We have a right to it, derived from our maker. That was in 1765. Nothing's changed. Mandating masks is only giving in to fear, lies, shaming, and it emboldens those who think vaccines should be mandated and that you should be forced to carry a vaccine passport. You've heard me say this before. It's all about compliance and control. In the big picture, I don't even think it's about political parties, but it's about power. I'd like for the county health advisors to show us the peer-reviewed studies for the unconstitutional, freedom-stealing measures like mask mandates and vaccines. So I hope they'll do that. I saw today where the Texas Supreme Court has temporarily blocked local mask mandates there. God bless them. The Wuhan virus is treatable. There are remedies. Ask yourself why pharmacies have been ordered not to dispense the life-saving drugs, hydroxychloroquine and ivermectin, drugs that have been on the list of essential medicines for decades and used for 70 years. They're not allowed to be dispensed, not for the purpose of treating this virus. You say they aren't approved by the FDA for that purpose. Well, this vaccine only has an emergency use authorization. It's not been approved either, but it's sure being pushed. And the passport, it's not coming, it's here. New York became the first major U.S. city to introduce COVID-19 vaccine passport systems. You can't buy and sell unless you show your passport. Can't go to a concert, can't go to certain restaurants. French citizens, if you've seen this in the news, and they're not the only ones, they're holding demonstrations because the COVID-19 passports take liberty and freedoms. And it's a way, they think, to segregate society, segregated, and for political purpose, not for health reasons. So I wanted to read a couple of things. This was July 6, 1938. Jews cannot trade anymore. July 23rd, 1938, Jews over 15 years old must own an identity card and have it with them at all times. You don't think mask mandates are a big deal? Think again. Thank you.
Thank you, Kay. Would anyone else like to address the board? I don't have anyone else signed up. Okay. Seeing no one, I'll close the public comment session. I'll move on to constituent concerns. I was wanting to bring up a couple of things. Well, I'll tell you what, I'll wait on that. I want to call on Sarah Henderson, our health director, and Dr. Jabin and Travis to talk about kind of what's going on in the county right now. So appreciate y'all coming out. Welcome, Dr. Jabin.
Good evening. Thanks for having us back. It is time to bring back something from the early days of this pandemic, unfortunately. You will remember the term bend the curve. It refers to slowing the rapid rise in order to preserve the healthcare system for everyone, infected with COVID or not. And what I would like to say is that the pot is not only jiggling, the pot is overflowing. The case curves, which you see here for both North Carolina and Haywood County, which interestingly are pretty similar, is being reflected not only across the South, but most of the country right now. And if we looked at what's happened just here in Haywood County, for instance, in mid-June, we were in the green zone, less than one case per day, one new case a day average on a 7-day rolling average per 100,000 population. And at that time, given the virus we were facing, there were enough people vaccinated, enough people wearing masks, and being careful to get the numbers down and to keep them there until things changed. Now, fewer and fewer are wearing masks, even in high-risk situations. The virus we are now facing is much more contagious than the one we were facing earlier in the summer. Whereas one person before would infect 2 to 3, now it's more like 6 to 8. And we've seen this in the clusters here in the county just in the past few weeks. Before, in a group of 10, for instance, if there was somebody infected, maybe 2 or 3 would convert and become infected. Now it's the whole group. And so here in mid-August, we have gone from the green zone at less than 1 per 100,000. And as of today, we are deep in the red zone at 45 per 100,000. That's going from 0 to 1 case per week up to 196 last week, and on a pace for even more this week. So it's pretty clear that we as a community are doing or not doing, whatever we're doing or not doing is not enough to contain this virus right now. And certainly you can see that in the curve there. What you'll also notice is that curve is showing no signs of reaching a plateau yet. It will at some point. The question is, where will that actually take us? Sarah, do you want to add some local numbers? Okay. All right. Next slide, please. Thanks, Amy. This is, Georgia Tech has a site where they calculate the risk level in attending an event. And what they're actually looking at is what is the chance that at least one person in a group will be infected. As you can see here for Haywood County today, in a group of 100, there's a 70% chance that somebody there is going to be infected. In a group of 500, it's virtually 100% chance that there's going to be somebody there infected. And I bring that up because we are facing not only the school situation, but we're facing Labor Day events, both the county fair and Labor Day events in Canton and other places. But we're also looking down the barrel of festival season, which is a big deal around here. This case curve continues to go up. What will happen to this estimator, this risk level, is that smaller and smaller groups will start to have a 100% chance that there's somebody there infected. Now, we've known from the beginning that we were not going to prevent somebody there from being infected. The goal was to prevent that one from becoming 100. And with the increased contagiousness of this virus, gathered together with people not being as careful as they have been, I think you can see where that's going. I hope that I'm proven wrong here. But right now, it appears this risk is going to go up, at least for the next few weeks, not down. Next slide.
So this slide just gives you a visual of a cluster that we currently have in Haywood County that actually started before school started. It was a work-related cluster, started out with 5 employees, escalated to 9 within the first 48 hours, and was up over 16, 72 hours after it started. Just some recent numbers. As of today, we have 5,098 cases total in our county. Dr. Jabin said we logged 196 last week. We logged 73 for the weekend this week, so we'll be well over that number this week. On top of this cluster, there are currently 24 other employees with the Haywood County school system that are either isolated or quarantined right now, and today is day 1 of school. Since that school board meeting, we have logged another 473 positive cases in our county, and 53 of those were between the ages of 5 and 18. So those are all in our school system. We have 30,941 people who have been partially vaccinated, 28,636 who are fully vaccinated. We're tired. The healthcare system is beyond tired. My public health nurses, the hospital, Travis's staff with EMS, our rescue workers, the fire departments, those first responders on the scene are exhausted, and we have a long way to go. I don't mean to be a Debbie Downer, but I'm not sure that we will have the staff to do what we need to do. We hear the word boosters all the time. For the immunocompromised, we talk about maybe mass vaxxing those. I'm not sure that Travis and I could put together a staff to do so right now. The masks are important, the vaccines are important. The Swiss cheese model that you're going to hear Dr. Jabin reiterate is important. It takes all of us, it takes a village. And the numbers are going to get worse before they get better if we don't change the trajectory. Do you want to finish up?
Good afternoon, Commissioners. Here to talk to you a little bit tonight about the state of your local healthcare system as a whole, as well as a region, a state, and pretty much the entire Southeast right now. Had a call earlier today with regional EMS folks, administrators. Everybody's feeling the same burn and crunch that we're feeling right now. We can't get our patients out of our ambulances because our hospitals are full, our ERs are full, our urgent cares are at capacity. Currently, if we keep our current trends, folks in Haywood County are going to have to wait for an ambulance to show up because there's not going to be another one for maybe an hour or two to come help that patient. That's something that's not happened in a really long time in this county. And I never honestly saw it coming, at least quite this soon with this surge. I thought we had another month or so before we really got to the point where we're at now. And this was merely 2 weeks ago. As far as outside resources coming to help us right now, there's not anything coming. What Haywood County has here in Haywood County is what we got to take care of our own. And right now that is being overrun. Today, this week, yesterday. Our healthcare system cannot continue at the pace that it's running. Citizens, visitors are going to see healthcare issues that are not taken care of in a timely fashion, in a fashion that they're used to those being taken care of. A simple broke leg, something that, you broke your leg, you went to the hospital, went to the ER, and got it fixed and got back home. That might take you a couple of days now. There aren't beds for folks to be admitted to into ICUs and or for non-COVID related sicknesses. Folks are still getting sick with other things. And the surge that we're in, along with a bunch of outside factors, staffing and healthcare is really putting a crunch. And there are a number of other factors that are all contributing to our current situation. If we don't change the direction that we're in right now, I can't tell you what the future holds other than we're being overrun right now. And I speak for our neighbors in other counties and other hospitals, everybody's feeling the same thing. Again, typically in America, we're set up for a couple of disasters to occur at one time, at most. And this is a healthcare disaster at the moment. It's a crisis, and it's real, and it's on our doorsteps. My staff, our hospital staff, your nurses, your doctors, your paramedics are all overwhelmed right now. They're experiencing stuff that, you know, I couldn't fathom, just trying to beg and plead to get an ER room to get your patient off of that you've already been taking care of for 3 or 4 hours waiting on a room. That's something I never fathomed having to do as a paramedic, and my folks are doing it every single day right now.
Another example that might help illustrate this for everyone is late last week, there was a patient with a very time-sensitive, life-threatening illness, time-sensitive. They had to take him by ground to Chapel Hill because that was the closest place that could take care of his problem. And again, that's just representative of the kinds of things that are happening. Now, I'm not saying that's happening every minute, every day right now, but you can look at the case curve and see where this is headed if that's what we're seeing right now. And you know, right now, it doesn't really matter if you want to believe this is a pandemic or not. It doesn't matter if you think the cases or deaths are inflated or not. It doesn't matter if you want to believe masks decrease your oxygen, they don't. If they increase your carbon dioxide, they don't. Or whether they add a protective layer to the layer approach of prevention, the slices of Swiss cheese that you've heard me talk about, well, they do. Whether after more than 300 million doses of vaccine being given just in the U.S., you believe the risks of vaccine somehow outpace the risk of getting COVID, dying from COVID, or having symptoms that don't go away with COVID. Whether you think the CT value of a positive test should be higher or lower, the false positive rate of the test is higher or lower than is reported, whether you're fearful of getting sick or your kids getting sick, as Janet referenced, or whether you're fearful you're right somehow slipping down a slippery slope that never seems to happen in real life, as Kay references. If you think I don't know enough about statistics, please call me up because I'd like to be better at them. These are all smoke screens obscuring what is the real issue. What really matters right now in this county is there, and I would ask, is there anyone here whose life right now is not being impacted by this virus, infected or not? The real issue is we have it, it's harming people, whether physically, emotionally, spiritually, economically, politically, however you want to think about that. Right now, schools are the face of this. But honestly, it's been in our face in other situations as well throughout this pandemic. Religious gatherings, social gatherings, sports, on and on. It's time we bring back a relic of the early days to bend the curve to preserve our healthcare system for everybody. And there is a way to do this. As long as you and me are just another person for the virus to jump to, we will continue to face the harm. If you and me harbor the virus and give it that opportunity, we will all continue to face the harm. And I would hope that all of us want to stop the harm. I hope that all of us are on that same page. What's going to get this through a surge is this. Don't be someone the virus can jump to. Avoid high-risk situations, crowds, indoors, poor ventilation. And if you can't, wear a mask. If you're outdoors and you can't distance, wear a mask. And don't give the virus its opportunity. If you get any kind of cold symptoms, sinus, or allergy, isolate and get tested, because Delta doesn't have many of the classic COVID symptoms like loss of taste and smell. It's sneaky. It looks like all of these things. And if you have a close contact exposure, quarantine and get tested on day 5. And if you're on the fence about vaccination, let's talk about that. We're happy to answer any questions or concerns anybody has. But this is the recipe, and this is what it will take to end this surge and end the harm. You know, there are 2 possible paths here. We can do nothing, or we can do something. If we do something and that theory is wrong, well, all that we've lost is that we tried and it didn't work out. But if we do nothing and that theory is wrong, if we wish we had done something, then we've really blown it. So the question is, are each of us ready to do our part? And whatever you want to believe or whatever you believe about this, let's get the harm down, let's get this surge down, and then we can debate the points. But until then, we've got a real challenge in front of us. Thank you, and we're happy to answer any questions.
If you're having symptoms, where can you get tested right now? What do you recommend that someone does?
Yeah, it's a real challenge right now because with the increased surge, there's more testing going on. And I can tell you that the places around the community that are testing are all overloaded too. I had to get one of my family members tested this last week, and it took a couple of days. So right now, testing is a real challenge. We're working on something to open up testing and make it so that it's not that sort of an issue, to increase the capacity in the community. But right now, it's tough. If you think that you have those kinds of symptoms, the best thing to do is isolate yourself, arrange to get tested. Generally, it will be within a day or two, and just protect those around you. Take the responsibility to say, hey, it could be, I don't want to contribute to this, I'm going to isolate, I'll get tested when I can.
Does the rapid test that you can get at the pharmacy, are they pretty accurate? I mean, what do you think of those?
Right. So the rapid test, whether that's the antigen test, the rapid test, it's available over the counter. It's the same test as the rapid test used in other facilities. The test is only to be relied upon if you're in the first 5 days of symptoms and it's positive. Then you can be pretty well assured that it's correct. Any kind of negative result has to be confirmed with a PCR test. So if you have symptoms and you get a test, a rapid test, and it's negative, you actually do not know anything more than you knew before you took the test. A negative cannot be relied on. I think the real danger here, I'm in favor of the home tests. I'm in favor of people having that information, but just be careful about it. Again, first 5 days positive, you can pretty well say that's correct. But if you have symptoms and you do a rapid test and it's negative, and you go out and about, you may be giving that virus an opportunity to jump to somebody else.
Anybody have any questions for anybody?
Yeah, I had a couple questions, and
Sure.
any one of you all feel free to answer them. So what are the typical symptoms that you're seeing now with the people that have come down with COVID, and how sick are they getting? And then also, as a follow-up to that, when you see those patients, who of those patients have been vaccinated and who haven't been vaccinated? I mean, if you've got that information.
So I think the symptoms probably that we see are probably different than the ones Travis is seeing, because I think they're probably a little more advanced, more respiratory symptoms by the time he sees them. Any new onset of severe headache, any runny nose, any sore throat, all of those things should be treated, and you think, okay, well, it's allergies or it's the flu, but a lot of those symptoms are the same. Fever is still there. We don't always see fever, and not everybody has all of the symptoms. I looked probably like I think I pulled numbers one day last week. I had pulled like the last 100 people on the positive list. Of those 100, 9 of them were vaccinated. All of the hospitalizations I have seen in the last few days that I have watched the positive list are unvaccinated.
Okay, and have you checked with other health departments across the state? Is that the kind of numbers most of them are seeing? So 10% of the people getting it have been vaccinated and 90% have
Yes.
not been vaccinated. However, you may or may not see people who have been vaccinated who have it because their symptoms may not.
Correct.
They may not have many symptoms.
Right, and we're seeing those things in long-term care. Most of our long-term care patients are vaccinated, but they're not sick. They're positive, and we recognize that they're positive because once they have one positive in a long-term care facility, they have to begin testing every so often. And so you kind of catch the other positives along the way, but the patients aren't going to the hospital. They're staying in long-term care, and they're not sick.
Okay.
So, which is something that we didn't see, this time last year. We all remember the big outbreak in long-term care that, there were 90-something patients that were positive, and they lost, double digits of people that didn't survive then. So that's largely attributed to the vaccine.
Do you know how they're treating COVID now if you are in the hospital? I know the hospital folks are here as well, too, but you may know the answer to that.
It's on a case-by-case basis. There have been very few people that have been on the ventilator Part of that is because we're trying not to put people on the ventilator. We're trying to manage it in other ways. The medications that you hear about being used, dexamethasone, which is a steroid, remdesivir, monoclonal antibodies for people before they get to the hospital, all of that is being used, but it's on a case-by-case basis. I'm obviously not involved in those care decisions, so I don't know exactly what's happening. I think what we're seeing that actually helps people the most is what we've learned in terms of managing oxygen and managing, ventilation. That really seems to buy people the time that they need. Monoclonal antibodies are being used for people in the first few days of their illness as a way of trying to prevent hospitalization. That's where monoclonal antibodies have their role in this. So that's being used and is available at the hospital as well, and is being used. Yeah.
Have they talked about, I was vaccinated in February, so here it is August. And I don't know what they've been talking about as far as whether there's going to be some type of booster, whether they're going to recommend that.
So right now, they've come out and recommended booster for people who are immunocompromised. And we're really talking about like transplant people who had their 2 doses of vaccine and just did not get a response. That's about a quarter of that group of people. That's who they're currently recommending a booster for. There have been some cases where the 3rd shot has gotten those people the same level of immunity that immunocompetent people have gotten from the vaccine. What is clear about Delta is the vaccines are still the same effectiveness for bad stuff, hospitalization, serious outcome, and death, still in the 90+% range of protection. Notice I didn't say 100%, in the 90+% range of protection. What has changed with Delta is infectiousness and contagiousness, and that those rates of protection have dropped down sort of more 60% range. What that means is that if you were vaccinated, you have a higher chance now with Delta of getting infected, but your chance of getting bad outcome is the same low rate that it was before Delta. That's part of why you're seeing more infections, is because vaccinated people are getting infected. They're just not getting sick, and they're not getting badly sick. But as Sarah said, 90% of our cases are in people who are unvaccinated. So although you will hear more and more about the breakthrough infections, yes, they are there, but they're milder, and they're smaller in number because there are way fewer vaccinated people even getting infected than people who are unvaccinated.
So you think with the fact that we reduced the requirements for masks, I know that masks don't prevent it completely, but certainly it's it's kind of like, I think the other day I thought about we have a baseball net outside, and you throw the baseball and it hits the net and it bounces back. Well, if you take a golf ball and you throw it, it might bounce back, might not. And so that seems to be how a mask is for this virus. It might not get through to you. It may get through to you if you're wearing a mask, but you have a better chance of not wearing it, or of wearing it. So do you think the fact that we've reduced that and that people have been vaccinated, and now those people that are vaccinated can actually carry the disease, that we're actually seeing more cases because it's spreading more because, well, the vaccinated people could be spreading?
You go to the next slide there, Amy. So, yeah, it's back to the Swiss cheese thing that we've talked about before. It's a layered approach. Not one of these things is going to work more than any other ones, but together they work. I think what's happened here, Kirk, is that back in the early summer, there were enough people wearing masks. There were enough people following these measures. There were enough people being careful in the high-risk situations that we know about. And with that virus at that time, that was enough to keep it under control. But what's happened is things have changed, right? The virus is way more contagious, and people have, relaxed that a little bit. I mean, I have to say, I was enjoying not having to wear a mask in some of the places that I was before. But as was predicted early on in this pandemic, there were going to be rolling waves of infection. We were going to have to be able to pivot and accommodate that when the time was right. We were able to pivot away some in the summer. That was fine. But now, clearly, this is a time to pivot towards being careful about these things. So, yes, I think it's a combination of all of those things. What that says to me, though, is if enough of us pivot back to doing the things that we know work, we can get control of this thing. But clearly, as of right now, there are not enough people pivoting to do these things to keep it under control. I did not answer one thing you asked, which was about boosters for the immunocompetent. And I think until or if we see the hospitalization and death rate for the vaccinated start to go up, I think that's when you'll see a serious conversation about boosters. If it stays like it is now, where the bad outcomes are still protected by the vaccines as they have been all along, and it's a matter of an increase in infections, I don't think you'll see that. But that, I think, is the thing to look out for. When you start seeing hospitalizations and deaths among the vaccinated start to climb up, that's when I think that we'll have a signal that whatever immunity we were getting from the vaccine has waned somewhat. There's a lot of talk. People say, well, gee, I had the illness. Why should I get vaccinated? And it's clear that having had the illness does confer immunity to people. What we know from the studies is that the people who get the best immune response are the people who have had the disease, recovered, and then got vaccinated. Those are the people that can be the most protected in this going forward. There was also a study out from Kentucky last week where they looked at, vaccinated people. Make sure I get this right. They looked at people who had been vaccinated and reinfected versus people who were vaccinated and not reinfected. Hold a second, did I have that right? Well, I'm sorry, I'm not sure I have that right. But the outcome was that the people who were vaccinated were twice less likely to get reinfected. So what we know is even if you've been infected and recovered, thank goodness, the vaccine still has some benefit to be had for you. Let me just add, if I can, just one thing, because I know this is another question that comes up a lot, is can a vaccinated person harbor the virus and give it to somebody else? We know with the previous version of the virus that there was a vaccinated person who then became infected had a 90% less likelihood of giving it to somebody else. We don't actually yet know the number for Delta, but what we do know with Delta is that when they cultured people's nasopharynxes who are infected and vaccinated, they're carrying quite a bit more virus than they were before. And as we've talked about before, the issue of whether you get infected or not is a combination of the viral load that you're subjected to, plus or minus how your immune system reacts to that. So you would have to say that with an increased viral load, that chance of being able to pass it on is higher. Is it as high as somebody who is unvaccinated? Again, we don't know the answer to that. And this is why people, even vaccinated right now with Delta, need to be careful. You just can't throw your mask away and expect that you're going to be as protected as you were before, because the virus is that much more contagious. And yet, we know that vaccinated people are very well protected against the bad outcomes if they do get infected. Just want to add that.
Doctor, I know you've been in communication with Canton, and I saw where they scaled back their Labor Day celebration to the parade only. And I had been in communication with some of those folks, and I know I've got to talk to you about some issues around the county fair later, but what was the guidance you gave Canton? Because I know they'll have 12, 15,000 people probably along that parade route. Just going to try to practice the 3 W's? Did you tell them to highly suggest that they wear masks? What was the guidance that you gave them?
What we talked about, the first thing we talked about was limiting numbers, because you can't keep people distance if you have too many people there. Right? And as you notice, they have done that with their, I think with their Sunday event. They're going to limit numbers. So the issue is outdoors, obviously better than indoors, and people need to be distanced. And if you can't do that, they need to be masked. So what I know the town of Canton is talking about is how are they going to spread people out? What are they going to do to their route in order so that people can be distanced and spread? I don't know the details about how they're actually going to do that, but what we talked with them about was you got to limit contact. That's how the thing gets spread. And if that's a matter of limiting numbers, creating distance, structuring the space so that people can be distant, and then, of course, asking people to do their part. If they want to have this event, and it's a great event, people have a part to play in being able to pull it off, safely. So these are the things that we talked about with them. Sarah, do you want to add anything to that?
Does anybody else have a question?
Go ahead.
Go ahead.
No, yeah, you can go ahead.
Question I had is the length of time that the antibody stays in your system longer now than it used to be, or shorter, or do you know how long the antibody stays in the system?
I think the answer that we have so far is that they're hanging around for a while, both in those who had COVID and those who are vaccinated. Again, I don't think anybody has a specific answer to that yet, and I know that that's being looked at. But I don't know if there's a specific answer to that. I would also add that it's not just a matter of antibodies. Imagine this. You get infected, your body starts producing antibodies to fight off the infection. That's one of the immediate responses, right? But once the infection is cured and the infection is gone, why would you continue to make antibodies that you no longer need because the infection is gone? So if you just measure antibody levels, they will go down as is expected. But that doesn't mean that your immunity has waned, because what happens with your antibodies is the production factories actually go dormant. But they're there ready and waiting, so if the pathogen comes back, it can ramp up faster. The first time you're infected, it takes about 7 to 10 days for antibodies to be produced. But once you've had that exposure, once those cells go dormant and are waiting, when the pathogen comes back, they can ramp up in a matter of a day or two. So immunity is not just about antibodies, it's also about T cells and B cells and all this other stuff that I won't bore you with. But just understand that we have focused on antibodies because that's the immediate response and because it's something that you can measure. Some of these other things are a little bit harder to measure. I think that if someone who has had COVID lost their immunity very quickly, I think we'd be seeing a lot more reinfections in those folks. And we're not seeing that even till now. So I think without actually seeing a number here, I think what we can say is that natural immunity confers, an acquired infection confers some level of immunity. And so far, it seems to be lasting. What we do know is that if a previously infected person recovers and gets a vaccine, their level of immunity will be the most of anyone. And I know that there are people who listen to me say that and say, well, then why don't we just all get infected, get over with it? Well, that would be true if it didn't kill people. Even with a mortality rate, if I'll take Janet's number, 99.6%, multiply that by 350 million people. We've had over 600,000 people die in this country. So the percentages are one thing, but the absolute number paints a different picture. And it also does not speak to the people who get long COVID. It's thought about 1 out of every 3 people who get infected with COVID have prolonged symptoms, as defined as more than 5 weeks. Now, not all of those people go on to have it for months and months and years. And I have to tell you, I've not seen a number about what that number of people is. But it's a substantial number of that 1 out of 3 are still struggling a year later with their symptoms. You know, chronically short of breath, so fatigued they can't get out of bed, brain fog, can't function. So again, if it were as easy as let's all get infected and be done with it, that would be great. But unfortunately, that's not how it's played out.
Are you seeing a certain age group? Is it affecting kids now more than the variant before?
Yeah.
Or can you answer
So,
maybe?
Sarah, correct me if I'm wrong, but what we're seeing in the elderly who were bearing the brunt of mortality this time last year, what we're seeing is that the unvaccinated elderly are getting sick, and those are the elderly that we're seeing in the hospital. The vaccinated elderly are getting sick, but they're not getting sick that they have to go in the hospital. The example that Sarah gave, a Spicewood experience, is a perfect example. Memory care unit, right, 14 residents, all got infected. Only one of them went to the hospital, and that person did well. The rest of them either had minimal symptoms or no symptoms. Contrast that to what we saw at Silver Bluff this time last year. So that's for the elderly. If we go to the people between 18 and 65, that's where we're seeing the majority of our infections in unvaccinated people. If you go to kids under 18, we're seeing increasing numbers, and it really seems to be spread across all those age ranges. If you look at less than 4, 4 to 11, 12 to 15, 16 to 18. It's increasing in all of those week by week now, and increased compared to last summer when we had a surge in terms of that age group. Sarah, do you want to add to that? Yeah.
Yeah, the younger kids who are, because you have to remember, if you look at school age numbers, you've got, roughly 6,500 students in Haywood County. 3,000 of those aren't even eligible for vaccination. So some of the most recent pediatrics we have seen that were the sickest were ineligible for vaccines, under the age of 5, under the age of 6, 7. But we're seeing far more pediatric patients end up on the positive list than we were this time last year.
Do you know of that number, how many are vaccinated?
We've only got about 850 who are fully vaccinated in our county that are eligible.
Out of that 3,000.
That are eligible for vaccination, which is about 4% of those that are eligible for vaccination of that pediatric population who are actually fully vaccinated.
Do you see any complications at all with those that are vaccinated? The kids, yeah. I mean, sore arm, I guess, from any of them getting sick. I know that's a big question, a big concern that I get. That's the reason I'm posing the question. So,
are you talking about getting sick, like during the vaccination process?
Yes.
Post-vaccine,
Yep.
most of them are sore arm. Same symptoms that we saw with the adults. Every once in a while they get, somebody has fever. I had fever with mine for 24 hours. My mom, who's older than me, had no symptoms at all. We all had a sore arm. 2 of my children are vaccinated because they're eligible for vaccination. Neither of them had any trouble. Both of them complained for a sore arm for one day and it was over. So I want to test that being for every child. We know that there are always, risks with vaccines, but we have to decide whether the benefit outweighs the risk.
thank you.
Did you have a question, Jennifer?
Yeah, so Dr. Jabin, this is for you. I've listened to some of your videos, and I know that on social media we're hearing a lot of information about future variants, and so not to jump on to the next big thing, but do you have any thoughts on that?
Yeah. And before I go to that, I would also just want to reiterate that we have not had a serious vaccine reaction in the county for all the people who've been vaccinated, both doses. Mutations happen every time the virus replicates. Every time the virus replicates, there are mutations. Those mutations can turn into variants. It depends on what gets mutated, and it depends if the new mutated strain is more fit than the one that's there. Delta spread as fast as it did because it had an advantage for infectiousness and basically crowded out the original variant, Alpha, because it was just more contagious. As long as we continue to have infections, we're going to continue to run the risk of variants. As long as we run the risk of variants, we run the risk of a variant that evades the treatments and the vaccine that we have. That's the real challenge for the future. There will be variants. There have been thousands of variants already. There have fortunately only been 4 or 5 what they're calling variants of concern, the ones that could get us into trouble. So the answer to the question is yes, Jennifer. We can expect that there will be more variants. And we can expect that as long as this happens with case curve, we're going to be at higher risk of more variants. Yeah.
Do you have anything else, Jim? Okay, I was wondering, people that have previously had COVID, when they go and get the vaccine, does the vaccine kill any of the natural-made immunity that you have?
No, it does not. In fact, it boosts the natural immunity that you have. That's what the studies have shown. The people with the most robust immune response are those who had infection, recovered, and then got vaccinated.
Okay, yeah. Okay.
How soon after they've had COVID can you go get the vaccination? Is it 90 days?
No, that was before when there was a shortage of supply of vaccine. We knew at that time that people had at least 90 days of protection, and so we asked them to wait so that other people who were not at risk could get vaccinated. No, people can get vaccinated as soon as they're cleared either their isolation, cleared their symptoms, cleared their quarantine, they can get vaccinated. And I would add that there's lots of vaccine capacity in the community for people. If you decide that you want to get vaccinated, there's no problem walking into places and getting it. So, you want to ask something?
Just one thing for Travis. Can you just allude one more time? I think that we all understand that there is a great survival rate for COVID and this Delta variant, but talk one more time about the impact. I know last week we were on 100% diversion from the ER, is that correct?
Correct. Most of your hospitals in your area, in this area, are at capacity. Hospitals are on diversion. It's a statewide issue. It's a region-wide issue. Tennessee, same problem. South Carolina, farther south, no different. And COVID is a big factor in this, but I think anybody in the medical field right now can attest that not only COVID that we're dealing with para-influenza already here. It's still summertime. RSV in kids is absolutely running, I'm going to say, rampant.
It's pretty widespread.
And that's something we normally see toward the wintertime. And that is one of the factors that's got us to the point where we're at right now. It's a culmination of what I'm going to call a perfect storm between staffing crises and shortages in all healthcare, staffing shortages in EMS. I was on a call the other day. Pre-COVID turnover rate in EMS was 20%. Current data right now is reflecting 40%. In our field, that's not sustainable. Burnout in healthcare right now is a real thing. Folks are leaving at an alarming pace, and that is only complicating our current situation.
And the diversions are not, we're not diverting just COVID patients. We're diverting for, like you said, a broken arm or a leg or
Correct.
appendicitis or whatever.
Something plain and simple that would have normally been a very routine event for a patient to experience is turning into, a nightmare for those patients that have to experience that and are getting affected by the very wide grasp of COVID and these other factors that are at play.
Okay. Thank you.
Travis, what exactly is diversion? Can you just describe that? I know that means something to you guys, but what does that mean to the general
Diversion,
public?
once a hospital gets to a certain level, our big problem right now locally and regionally is our ability, or the hospital's ability, to admit patients up to a room, up to ICU, up to a floor in general. Those floors are full. They've got staffed. They've got the beds that they've got staffed the best that they can, but that then plugs up the whole system. The ER cannot admit patients upstairs, and then they end up holding patients that should be in a medical bed upstairs in the ER, which then backs up everything through the front door. Once these facilities get so backed up, they go on diversion, because if we show up there, all we're doing is sitting in the parking lot waiting on a hole that might open up in a couple hours.
If somebody is really ill, do they have priority or something? Or, I mean, how do you...
I can tell you that, speaking to our crews in the past week, patients with fairly significant trauma injuries that would normally get a fairly quick, easy bed through the ER that we're medicating and treating, we're having to drop off and triage. And these are patients that normally would be fairly fast-tracked through the system.
You have to, now, say that again, you have to drop off triage? What does that mean?
If we're taking care of a patient, for example, over to Asheville, and instead of the ambulance taking the patient directly to the room in the ER, we're going to take you out to triage and put you in a chair because there's no room in the ER to put you.
Oh, okay.
Travis, is there something that the public can do, I know the ones that are listening and watching, that could help slow that somewhat? I mean, if you have minor symptoms or something that you'd normally want to go to the ER, do you have any suggestions?
If it's minor, obviously try to seek care through your primary care provider or the urgent cares. We have several here in the county. And try to reserve those ambulance calls for life-threatening emergencies And if you don't have a choice as far as transportation, but do try to reserve the 911 calls that we've got to things that really need our intervention and an ER visit.
Yeah, it also just to sort of dovetail on what Travis is saying, to your question, Kevin, if somebody has a heart attack, a stroke, something that is imminent and right now, yeah, those people are getting taken care of. It's, right. they are being, that's what triage is. Triage is devoting the limited resources you have where they can do the best good. And so if somebody has a really time-sensitive thing like that, yeah, they're going to get taken care of. Everybody else down the list of immediacy are going to have to wait. And when you're in a limited situation, whether that's on a battlefield or an ER, that's what it's going to be. I can tell you, 35 years in the emergency department, the scariest times for me were when the place was full with sick people, and you're looking at your staff going, can we handle another sick person? And when everybody's got like deer in the headlights sort of look in their eyes, that's when you go in diversion. So it's not like places go in diversion lightly, but that's the sort of situation that diversion conjures up. And I think nobody likes diversion. What really gets difficult is when everybody's on diversion. Yeah. And right now, everybody's on diversion. That's what we're talking about when we're talking about an overwhelmed healthcare system. That's what we're talking about when we say we've got to bend the curve. We've got to slow this down, because right now, COVID or not, everybody's going to be impacted by this. And I think if people took one thing away from this, what they can do is be careful about their healthcare decisions. But if you've got something you're really worried about it, by all means go to the hospital. But if not, if you can get to a different place, that really helps. Even more importantly, what can you do to bend the curve? I understand there are people who don't want to get vaccinated, and I understand there are people who don't want to wear a mask. And if that's your choice, then by God, do the other things you can do to bend this curve. Be careful going out into crowded places. I mean, there are things you can do beyond those. Should you do those? Are they more effective if you wear a mask and get vaccinated? Of course. But that doesn't mean that you can't do something to help this. I kind of say there are three groups of people right now. There are the people who choose to be vaccinated. There are the people who choose to be vaccinated or can't be vaccinated, but who choose to be careful. And then there's a third group of people who choose not to get vaccinated, choose not to be careful, and choose not to be aware. And I think it's not too hard to think about who's carrying the biggest risk there, not only to themselves now, but to the community. So those are the things that people can do right now. I think when I was here last time, I talked about the case curves in Great Britain and Netherlands and Missouri. And if you look at those, in the UK and Netherlands, they had a very rapid rise of cases, a very short peak, and a very rapid downturn, although Great Britain has sort of slowed their downturn. If you look at Missouri, they started their Delta surge in May, and they're still going up. Right now, our curve looks more like Missouri than it does like the Netherlands and the UK. We need our curve to look like the Netherlands and UK. And it's not going to happen if we do nothing, or if enough of us do nothing. It's not like it takes 100% of us, but it takes enough of us. That's what we learned early this summer. Enough of us did, and we saw this really contained. Now, enough of us are not. You can see what's happening. So, as has been true all throughout this pandemic, it's up to what people do. And I would hope that people, even people who are against vaccination and masks, would do what they can right now in the interest of the whole community to really get this curve down. And then we can debate the points. Right now, this is like saber-toothed tiger chasing us down the field.
Does anybody have any other questions or comments? Okay. Well, I appreciate y'all are doing. I know I was reading an article about a nurse in Missouri, in Springfield, and she was talking about, I guess she was over the floor of the COVID patients. And she said it was full back in February, and now it's back full again. But basically her floor, she said that's where they come to die, is actually what she said. And she was just, I guess, I could kind of feel her, in reading the article, I could feel her, and I kind of feel that when I've heard you all talking at our policy group the other day, of how that it's just so overwhelming, and she feels like that people aren't listening to what people are telling them to do. And she's just, they were just, kind of like you guys, just kind of burned out, if you will. So that kind of pointed to, everything that y'all are saying, and it's kind of like it's getting here now, I guess you could say. So, but it was tough reading that article, but, it's so true. So, and she'd look at patients. I tell you what got me was she'd look at patients, and they were still in denial that they had COVID, and they had COVID, and they were like dead in 5 days. And it's like they were still arguing with her about everything. And she was like, we're here to help people, and it's like they don't want to, but, basically they were there because they had to be there because they were so sick and stuff. And that was really what was surprising to me, was somebody would be still so adamantly against, still, kind of coming out with the conspiracies that it doesn't exist or something, and they were sick there dying with it. So, but that was kind of a wake-up article to read that and everything. So, but I appreciate all the work you're doing, because I know you're overwhelmed, and you go home at night and think about it. Probably, it's always before you, because when you get to work the next day, there it is. So, I appreciate everything y'all are doing, and y'all hang in there, because I'll be praying for you.
Thank these two. Thank all the people on the front line, because those are the folks really laying it out there.
Yeah.
Thank you, guys. Thank you.
Thank you.
Thank you.
Yeah, go ahead, Travis. Did you have something?
Kevin, I did have something that was not COVID related. Want to bring everybody's attention to the remnants of Tropical Storm Fred.
Yeah.
That will be coming through tomorrow night. Current forecast is 8 to 10 inches of rain south end of the county in the headwaters. As the storm comes up, it's going to get squeezed as it comes across the escarpment. There is the possibility, per the National Weather Service, that there may be an excessive 10 inches in areas in the south end of the county. So everybody just needs to be aware of the flooding potential for tomorrow and tomorrow night. And if you live in a low-lying area that normally floods, you need to start making preparations now.
Okay, yeah. Oh, that would be me. Okay. My office, I got my work vehicles there. I always got to kind of pay attention. I might need to move them. Okay.
Floods with sprinkles.
Yeah. You what? Sprinkles?
Floods back there with sprinkles.
Yeah, just about. Okay. Okay. Then under constituent concerns, at our last meeting, we had a veterans group here that would. They never really said what they wanted, did they, Bryant? They were asking for help, and I was wondering, would it be okay if we reached out to them to see what they needed exactly, and if it was maybe just like a small donation, would y'all be okay with that, $1,000 or something? We've got a commissioner's account. He was just saying they had a tough time. The veterans group was trying to raise money. They had a tough time with COVID. He was just wondering if and I think we helped them before, if I'm not mistaken. So is that okay with everybody if we were to do something like that?
You maybe find out what they need, or exactly what they want.
I just wanted to follow up on that, because it was a veterans group, and I really wanted to.
Like to support them.
Yeah. And then the other thing I had a call about was the schools are trying to do a working farm at Tuscola, and Bobby Rogers, I think he talked to Tommy, right, Tommy? Did Bobby talk to you? And they were needing some jump start money. I think the Farm Bureau has given him $25,000, and he was kind of requesting maybe up to $50,000 from the county commissioners to help with that working farm there. And I was just wanting to put that before y'all and see what y'all thought about it.
Pisgah has a working farm. How did that come to be?
Yeah, that's what he said. Pisgah had one, Tuscola did.
Yeah, that's a question I have. I wonder if did we give any money during that time?
How was that created? Do you know?
I do not know, yeah.
Did we give any money to Pisgah as well when they started theirs? They've got one, I know.
I'm not sure if we gave money at that time. I can research it and find out, but I
Okay.
Now let's find out and see
Okay.
how one became.
I mean, I'd be willing to help. Just need to be fair, I guess.
Yeah.
I know we have a strong farming community, and I want to, I think it's great that people are going into farming, but I think as much as we can show our young people that, the better we all will be.
My son was involved in that with Pisgah, and it's an excellent program, and there are many careers that students can, business and all sorts of things that are related to farming.
Yeah.
And it definitely is a good program, but we probably need to know how one got started before we.
Okay. Well, maybe look into that. I just want to kind of bring it before you because Bobby was asking about it, so.
Well, I know I would support it simply because, I mean, I don't think I think there's always this east-west thing about we did this for that or this for the other, but I sat in here when we approved a building project for Pisgah when Tuscola didn't get the same, so I don't know that we need to necessarily make sure that, as a matter of fact, I asked a lot of questions about that building project and the amount of room we had at Tuscola there was at Tuscola for students. And that got nixed, and they went ahead and built the facility at Pisgah anyway. So it wasn't a quid pro quo for the two schools. So if this is something that they're interested in doing, and we've got the money to do that, same as we did for Pisgah when they wanted a new building, I think that I would support it.
Okay.
Well, I would speak to the fact that FFA is more than just what you might think about some kids farming or fooling with a cow or sheep or goat or something, some animal husbandry. It is an in-depth program, and for people to go through FFA, they generally become a good mechanic, a good accountant. If you do farming, you have multiple skills, and I think it is a skill-building situation that we could, if we could help them, I'd certainly entertain it because it helps kids. It has a structured program, and agriculture is the biggest industry in North Carolina. I don't know if you knew that or not, but it is the biggest industry in North Carolina. It is an economic mover. Everybody here likes to have 3 good meals a day. I love a good breakfast. The chicken contributes to that breakfast, but the hog makes a true sacrifice. Nobody got that, but anyway. If we could help them, I'd be willing to entertain helping that if we could find out what they're needing.
Bryant, could you check to see about the sales tax situation too? I mean, what kind of money they've got and the availability of funds?
We haven't finished last fiscal year for June 30th, but they were, I think I talked with Christian a couple of weeks ago, they're pretty close to about $3 million in sales tax revenue that's accumulated. So they have capital money, if you will.
Okay.
Hey, does anybody have any other constituent concerns? I didn't mean to take all that time.
Well, I do. I want to thank Commissioner Kirkpatrick for doing that explanation there. I also got several emails about that situation that he explained. And also, I'd like to report that I did spend some time with the North Carolina Association of County Commissioners this past week. And we installed Frank Williams from New Hanover County as our president for this year. He took over for Commissioner Ronnie Smith from Martin County. And his president's objective this coming year will be emergency preparedness. And them being on the coast down there, they're very familiar with preparing for an emergency. And I know Travis just spoke of an impending situation that we may have a heads up on. So the best time to plan for that is not during the emergency, but be ready to hit the go button when that occurs. I know we do a good job here in Haywood County, but that's going to be the focus from that group this coming year. Anyway, it was a privilege to serve you guys down there, and we elected second vice president. I was a voting delegate, and we elected second vice president from Warren County. T. Davis, he's a highway patrolman, serves as county commissioner, and he'll do us a fine job. I did aggravate him a little bit. You want to talk about schools? I did aggravate him a little bit. One of his board members is Victor Hunt. And if you're watching this, T, I'm going to aggravate you a little bit more. Victor Hunt's son started the point guard for Warren County, and when Pisgah beat him in Chapel Hill for the state championship basketball. So I did get to aggravate him a little bit about that. But I did learn, speaking on schools, I see a representative in the back. If the budget gets passed, the big talk at the NCACC was school funding. They voted to blow out the tier structure qualifications, which is a big help. They got that in the budget. They blew out the grant for new schools from $10 million cap to $25 million. If that gets passed, It'd be great for opportunity for school boards. I already messaged Chuck Francis about that. The money is brimming. The repair fund down there was projected, they was trying to get 40% in it. It's a mathematical calculation. They figured it'd be 2028 before they reach that level. And they're projecting to have 48% in that fund this year. And so if that gets pushed through, it'll be good news for our public schools and school boards all across the state. So they've done a good job with the money. So do a good job with that money and be good stewards of it and put it to good use. So I did want to give that report.
Okay. Does anybody got anything else?
No, same thing. Had similar emails that you guys have had, and it's already been addressed. And I did have a few other ones that I got with Mr. Moorhead on, and he's always good about addressing them. So thank you for doing that.
I had several emails in regards to the old Sawnook School, and I think Bryant has been talking with some folks with Mountain Projects about that as well, and I guess we'll let that play out. I just want to make sure that those folks that have sent emails in regards to that, I'm sorry I haven't returned those, but the county does not own the old Sawnook School. Mountain Projects owns that school. So right now that's an issue between Mountain Projects and the folks that want to make the Sawnook School a community club.
Community center.
Community center. Community center, yeah.
Try to help you out there.
I appreciate it. I need all the help I can get. And the other thing is, I texted my wife when the lady was speaking about not being able to provide ivermectin and hydrochloroquine. There's no, if a doctor writes a prescription from one of those drugs, we can fill it. The pharmacies can fill those. So that statement she made is not accurate. I wanted to check and make sure.
My neighbor informed me 2 weeks ago that her doctor wrote her a prescription for ivermectin. She's taking it, I thought she said about a pill form daily. She's taking it. She told me she was taking it.
That's all I had.
That's good to know, Kirk.
You can get it. So, that is good information for the folks that says they can't get it.
But you have to have a prescription. We can't just hand it out.
Yep, her doctor gave her a prescription.
Yeah.
Well, there are some things we can hand out, but not those.
I had the same set of emails. I appreciate the folks in Sawnook. You know, like Kurt said, we don't own that building, but it's good to see them kind of rally together and, you know, all have the same passion for that building and for their community, and so it's nice to see them come together and, you know, rally to see that come to pass. Did have some, you know, the same set, I think, of concerns about the homeless, and I hope the homeless shelter, whatever they thought that was going to be. So I'm glad to appreciate you talking to him and saying that, speaking on his behalf. You know, we live in a time where we've got a lot of things on our plate and we're all concerned, and it's we need to make sure we're operating with all the facts, because it's a trying time for all of us, and let's not try to make it any worse.
Okay, if that's all constituent concerns, I'll move on to administrative agency reports and presentations. And we have Haywood Regional Medical Center, Duke Life Point Community Benefits Report, and we have our Haywood Regional Medical Center CEO, Greg Caples, here this morning. Welcome, Greg. This afternoon. I appreciate you hanging in there with us.
Thank you. I appreciate you giving me a little time today. I did want to present some information that we have shared now with our community benefits report, which gives some highlights of the things that our hospital has done, not just related to the health status of our community, but also the economic impact that we help to provide for the community. And so I'll try to cover this quickly, and I'd be glad to also give you a hospital COVID update since we've already had some of that information shared tonight for the county. So if you could, do I control this? I'm sorry. There we go. Thank you. Okay, so this is all data from last year, and of course, as you know, last year was a down year in a lot of ways economically for every entity and certainly for the hospital as well, but we still had quite an impact, I believe, on this county. So during 2020, we added 58 employed, affiliated, and telehealth providers to the hospital's medical staff. We also made approximately $2.6 million in capital expenditures during the year, which included things such as a new nuclear medicine camera, MRI-compatible monitors, several things that are related to infrastructure and mechanical type upgrades to the facility and other things as well. So very glad to be able to make those investments. We also distributed a payroll of almost $63 million to approximately 870 employees, which is less than usual, but still, I think, a significant impact for our county. We also provided more than $20 million in services to those that are in need that have had no ability to pay. And so we're very glad that we're able to provide those services regardless of a person's ability to pay and can help in those ways when they need it. We paid nearly $8 million in taxes last year, which again was less than usual, but still is a significant number. And most of those taxes are state and local. And so we're very glad to be contributing to those tax dollars that are raised to support all of the services that are provided in the county. If you can go to the next page. And I'm not going to read this off to you, but we try to be a good corporate citizen in the community through the things that we support financially, as well as through the efforts that individuals that are at the hospital provide through their time. And so there's many local agencies that we have donated money to and to help the causes that they support, and provide many other things through the employees there that give of their time to help these agencies and the work they do. Be glad to answer any questions that you have.
I think at this point in time, has the hospital I think they've fulfilled their responsibilities on capital improvements that we had with the sale of the hospital, haven't they?
Yes, the original money that was set aside has, as of 2020, was completely exhausted at that time. But we still, it doesn't really change our outlook on the things that we need to invest. And so we've got support from our Duke LifePoint partners to continue to do the things that we need to in this community.
All right, I appreciate that.
Yes.
Thank you for serving our community the way you do. I noticed a $62 million payroll, 870 employees. That's a good thing to have in our community. Provide a lot of good jobs, do a lot of good work for our citizens, and we're just thank you for continuing on.
Thank you.
Greg, how you doing? Good. Question I have, do you see any staffing issues at this time, or can you speak to that? Is it worse now than it was before, or you seeing people overwhelmed and burnt out, I'm sure?
Yeah, staffing is a challenge, and it has been really for a while. I'd say that even before the pandemic came about, going into 2020, that the nursing shortage across the country was a significant issue. It would have been clearly a top 5 issue probably for any hospital. And that was only exacerbated by the pandemic and everything that has resulted from that, as there have been some nurses across the country that have left healthcare, retired, or have moved into other areas that are not hospital related. And so that has kind of compounded the issue that's been out there. We compete with options that have been new to many nurses, such as the different types of travel assignments that they could take that have been very prominent during the last year and a half during the pandemic time period. And so we're constantly challenged to do the things that we need to do to retain our staff and to recruit and to bring in additional staff. And I'm speaking of nursing, but there are also concerns in other types of professions, as well as areas like housekeeping, dietary, certified nursing assistants, and just really many areas are presenting a challenge for us now. We have made some improvements and some progress this year in nursing, and so we've reduced our vacancy rate significantly since December, and so that has been a welcome relief as we in part have hired new grad nurses, and in part have been able to hire experienced nurses. And so those are coming online more and more over time. Some are still in orientation that were a part of the spring class for the graduate nurses. But we've seen some things that are encouraging to us and have been an improvement from where we were at the end of 2020, where there was a lot of turmoil last year that caused a lot of dip in the patient volume for things that were more elective, and that caused really stress on a lot of hospital systems throughout the country. I came here really at the beginning of the fourth quarter, and so spent the rest of my time during the pandemic in a different market. But a lot of the issues are the same, and have been of concern during that entire time. But I am encouraged by some improvements, as I've said, during 2021, and we'll continue to work on those areas and do the things that we can to make sure that we are able to take care of our community.
Anybody else have any questions? Brandon asked mine, so.
Okay.
Are you seeing staffing issues in areas other than just nursing, technicians of sorts, or other departments?
We do see some staffing shortfalls in areas that are not nursing related, and some of those will ebb and flow over time. We had a period of time where lab technicians was on the list of very high priority, and we've been able to have some recent hires that have helped us in that way. We do have some improvements that we've made in some of the therapies, like physical therapy and others like that. But we continue to see some concerns in like certified nursing assistants, some that are on the kind of the lower end of some of the pay scale. The competition for those positions has expanded to many other types of work. And so for housekeeping and dietary and many others like that, we've seen a lot greater competition for those types of workers, and so that has been a priority for us to address. And so it's not just nursing, but some of those things will change over time, and fortunately some of them are better now, but then some are have eroded somewhat, and so we just have to continue to pay attention to what the current market trends are and how we can address those.
Do you have particular initiatives in place to keep your staffing up? I know that the reason I'm asking that question is because I read something this week that we were provided with that this hospital was only staffed at about 80%. So I'm sure you are, but is there something that makes you more special than other local hospitals where people would be inclined to work here instead of someplace else?
Well, I mean, we do work on things related to culture and what it's like to work at our hospital and within our system. People tend to place a lot of weight on the relationship with their supervisor and manager, and so we do a lot of work related to how they can pay attention to the needs of their staff and address them. We measure those things through surveys that we do, and then have action plans, and some of those have just recently been updated and put into effect based on direct feedback. We've done reviews of compensation so that we can make adjustments in that way as we need to. We try to look at the ways that we communicate with our people so that we're keeping them informed of what's going on, and all of the activities and things of interest to them so that they understand kind of where we are. Recently did a series of employee forums that I held with staff that could come and listen to updates related to some of the top areas of attention that we have, such as our quality and patient safety, our people, our patient experience, our growth strategies and things such as that, so that they can hear it directly from me. So it's a constant challenge. It's not something that we've perfected or that we are satisfied with, but we do try to work on the things that help people to understand that we're listening to what their concerns are, and we want to address them the best that we can, and continue to foster the teamwork that we have. And I want to definitely say thank you to our team and to the folks here that have already presented, because there's a tremendous amount of collaboration that goes on between the county agencies and the hospital, and that's really been key, I think, to how this county has addressed the COVID concerns that have come up in various ways, and those challenges have changed and evolved over time. But it's that the teamwork, I think, has been commendable to be able to work together and to try to do the best we can for the people in the community.
Okay, does anybody have any other questions?
What's the census right now?
Our census is in the mid-70s right now.
So is that at capacity? I don't think it's at capacity physically, but as far as being able to have the employees to take care of patients, is that capacity right now?
So it's close to probably what our limit is. That can change. There's many factors involved with it. It depends on what types of patients that we have as inpatients, because there's different staffing patterns depending on if they're behavioral health or if they're ICU or if they're med surg. And so some of the changes that happen related to the mix of the patients can affect it. And we're currently on critical care diversion. I know diversion was spoken about earlier. And so that means our ICU today is at its capacity for staffing. And so it's a daily, really hourly management function that all of our team of leaders and caregivers are constantly working on. And it's something that we share the concerns of our county agencies about how COVID is impacting us right now, because today we have 22 patients that are COVID positive, and so of the census that we have, that's the COVID component of it, and that has increased over the last 3 weeks significantly. We were at about 5 3 weeks ago, and so we hope that we don't go up much further than that, but we don't really know what to expect, and so that's kind of the challenge that we face right now. One of the things that I did want to share with you is it was mentioned about monoclonal antibody therapy, which is something that we do offer, and it has been available from us since the beginning of the year. And the demand was not significant for a long time, but now in the month of August, we're seeing about 4 times the demand for that as we did in July. And it's very helpful, because it's a type of therapy that is intended to keep patients out of the hospital that are COVID positive. And so that's something that we will continue to provide, and it presents a challenge to us, too, to make sure that we can provide it timely. There's a 10-day window, and we have not come close to missing that timeline with any patients that have been referred to us, and so we'll continue to work on making sure that we can get to them as quickly as possible. But that's something that I'm very proud of our team. They've worked hard to be able to get that in place, and it's providing a very good benefit, I think, to patients to prevent them from being hospitalized.
Greg, is there a certain criteria you have to meet to have that done? Certain age or certain symptoms? Or?
Well, I'm not clinical, and so I don't want to give too specific an answer. I do know that you need a physician order for that, and so they are aware of what those indications are and what stage of COVID that a patient is in to be eligible to have that service provided for them.
Do you have an idea of the average length of stay of the COVID patient? I know that you've gone from 5 2 weeks ago now to 22, but how long are you seeing them stay there?
I don't know that number. Be glad to provide it, but I don't have it off the top of my head. I know more about, I guess, the general population, because we're treating all the normal things that we do: sepsis, congestive heart failure, pneumonia, and many things like that that kind of go into the mix for us. And during the heaviest COVID time, which was in December and January, our length of stay did go up in total. And so it's good to know that right now we're not seeing as high acuity of COVID when we do have it. The average age of the patient is less than it was. At that time, we were probably close to 80 as far as the average age of a COVID inpatient back in December and January, and now we're around 65, and also not as many that are ICU level, and very few vent patients, which is very important because that was a very difficult thing to overcome for patients that were COVID positive at the time. So it's good to see that the severity is less, and I would say that the length of stay is less. I just don't have the exact numbers, but I do know that it is. And so a much higher percentage of patients are recovering and going home.
Anybody have anything else for Greg? Appreciate you coming out tonight.
All right, thank you.
Getting us updated.
Thank you.
Okay, our next order of business is the discussion adjustment to the agenda. And I guess we need to have a closed session, which will be for attorney-client privilege, 143-318-11A3. Can I have a motion that we go into that when we get to it?
So moved.
Second.
Okay, all in favor indicate by saying aye. Aye. Okay. Does anybody else have a adjustment to the agenda? Okay. I'll move on to the consent agenda. Does any commissioner have any questions on the consent agenda with 4 items?
Just one comment. I noticed Greg's tax collections were the highest in the history of the county, if I read that correctly.
I saw that. That's good. Greg, you're here, ain't you? Yeah, Greg, Greg's here. Appreciate that, Greg. It's the highest in the county by far, I think by 1%.
Did we put a second box out there yet?
I appreciate the fact that the Haywood Healthcare Foundation's providing $30,000 for dental for our health department.
Okay, can I have a motion that we approve the consent agenda?
So moved.
Is there a second?
Second.
Any discussion at all? All those in favor indicate by saying aye. Aye. Okay, it's unanimous. Our next order of business is a regular agenda. The first item is to request approval of the 2020 settlement of collections. We have Greg here this morning. I keep saying this morning. It's this evening.
Good evening, Commissioners. Mr. Chairman, I'm here before you this evening to give settlement of collections for the 2021 tax year. Read a current statement here. I, Gregory West, tax collector of Haywood County, swear the attached report is an accurate statement of taxes collected on behalf of Haywood County and on the behalf of 25 fire districts, 10 road districts, 1 sanitation district, and the county landfill. The Haywood County Tax Office used diligent efforts to collect the taxes by attachment, garnishment, levy, and foreclosure. The tax collector will continue to use all enforcement remedies to collect these delinquent taxes. The net levy this year, which is the amount of taxes due for the year, was $41,526,108. The amount collected was $40,776,473, leaving a remaining balance of $749,635 for a collection percentage of 98.19%. As of today, our remaining balance is $597,000 for a collection rate of 98.52. So we've still been working since.
Can you click that? Or
yeah, this is next.
Oh, okay.
This slide shows the amount of collected and percentage collected over the last 12 years. The last 3 columns show that we had a 3-year collection percentage of 97.7%, but the last column shows the collected amount of $40,776,473, 98.19%. How will you move forward here? More time. Okay. The Haywood County tax levy has grown from $33.4 million to $40.8 million in 10 years. That's a growth of 19%. This year it took $408,000 to move 1% in the collection. As mentioned before, the 98.19 is, I believe, to be the highest in the county history, and those last 3-year average was 97.7%. The previous 9-year average was like 96.98%. We've not just, those are GO1 numbers, which are just general county taxes, okay? But we've also collected a lot of other money as well. We've collected $3.7 million for the 25 fire districts. We've collected $5 million for the landfill fee, $225, almost $226 for the 10 road maintenance, $246,000 for the sanitation districts. If we add that amount to the GO1, we've collected $50,102,000 this year. And also previous years, 2019, 18, 17, we also collect $783,000 out of those years. So when you add all those all together this year, we brought in $50,886,000 this year, which has been quite a big amount, I think. I'd be glad to answer any questions concerning this settlement.
Greg, I'm just curious, those last 4, I assume, are fire districts, 22, 23, 24, and 25. They were kind of small amounts. Do you know where those are? Or?
I don't know right off the top, but I would assume they would probably be pretty rural areas, maybe like White Oak, some like those small places. I can get that information for you, though. But $3.7 million for the fire districts, I thought that was pretty good. If there aren't any questions, I would like to request the approval of the settlement of collections.
Okay, can I have a motion that we approve item 1 of the regular agenda?
So moved.
Second.
Is there any discussion? All those in favor indicate by saying aye. Aye. Okay, is anyone opposed? Okay, it's unanimous. Okay, item 2, go ahead, Greg. It's the request approval of order collections for the Tax Collections Department.
Yes, Mr. Chairman, if it pleases the board, I would like to request approval for the order of collections for the next year's taxes, please.
Okay, can I have, do we have a motion to approve the item 2 of the regular agenda?
So moved.
Second.
Any discussion? All those in favor say aye. Aye. Anyone opposed?
Thank you.
Okay, thank you, Greg. Appreciate the good work there. Tell your staff we appreciate it too.
Yeah, I'd really like to give a shout out to them. Terry Watkins, Tanya Bailey, Emily Sapp, Tracy Wells, and Tanya Bailey.
Hey, Greg, I was in there today, and there was a customer in there. Of course, I'm in there about every other day or every day or 2 times a day. But and they really handled the customer well, explained his situation to him, and provided him with information, especially as far as his age and the ability to get a deduction in his taxes or a reduction because of his age and income. And I just thought it was handled well. So,
well, we really strive to help these people, because when they come in there, it's not the most easiest thing to hand over, half your paycheck or whatever it may be. So we want to give the best service possible and answer questions. And most people don't know about these exemptions and things like that. So we try to point it out as much as possible.
Do you know when will the tax bills go out? I guess they're coming due too, aren't they?
I think the deadline the assessor's got's coming up next week or so. So we should hope to get them out the first week in September if everything goes well.
Okay, good.
But the assessor's office is working hard on getting them ready. This whole second floor has worked hard this year, during all these COVID things. You know, when we were shut down, we were meeting people outside at the front door, which they were getting right up in your face. You really weren't protected, plus you're handling money out there. You never know what's going on with all the court system next door, people watching. So from Judy's office, Stephanie's office, and Register of Deeds, we've all worked diligently to provide good customer service to people during this time. Thank you all.
Okay,
Thank
appreciate
you.
it, Greg. Okay, then the next, and by the way, we had reval this year too, so that's another one that yeah, that they've had to deal with. Our next agenda item is the number 3 is to request approval of a resolution declaring firearms surplus and authorizing the trade of surplus firearms for other firearms. And we have our Chief Deputy, Jeff Haynes, here. Welcome, Jeff.
Good evening, Commissioners. What we bring before you this evening is a resolution to declare our firearms and authorizing the trade of surplus firearms for other firearms. To get into this, these are 21-year-old service shotguns that do need to be replaced. There's a resolution in front of you that reads as such. Whereas under North Carolina General Statute 160A, 265 authorizes the Board of Commissioners of Haywood County to dispose of surplus property, and North Carolina General Statute 143, 129.7 allows bidders to purchase as trade-in property owned by the county. And North Carolina General Statute 20-187.2b allows officers the option to purchase duty weapons at a predetermined price upon securing a permit as required by North Carolina General Statute 14-402A. And whereas the Haywood County has in its possession 42 used duty shotguns, which include a total count of 42 Benelli M1 Super 90 shotguns, 12-gauge shotguns, which have previously been used in service by employees of the Haywood County Sheriff's Office and are no longer of use by the county. Now, therefore, be it resolved by the Haywood County Board of Commissioners meeting in general session on Monday, August 16th, 2021, that the count of 42 Benelli M1 Super 90 12-gauge shotguns be declared surplus in order to be traded for new Mossberg shotguns with PF custom guns. The deputies have the option to purchase the same firearms from the vendor at a predetermined price upon securing a permit as required by North Carolina General Statute 14-402, adopted this 16th day of August 2021. We ask for that to be passed based upon the vendors that did come to look at the weapons and the offer that was placed. Several hurdles existed to begin with. We needed to replace these shotguns, which have seen quite a bit of use and age and so forth. Currently, looking at different vendors and so forth, Remington, which is a common law enforcement brand name, so is Mossberg, both very affordable and quite the market standard. Remington shotguns are very hard to get hands on now, not very available, and obviously to replace the Benellis would be almost double, if not triple, the cost of what the trade-in value is for those. We received quotes from Lawman's shotgun, or Lawman's, which is a police distributor out of Raleigh, for a trade-in cost of $510.75 per weapon, the cost was $510.75 per weapon to replace the Mossberg shotguns, and the cost came in at $506.34 per unit through PF Custom Guns, who is a federal firearms dealer and works with many sheriff's offices and police departments across the nation, and they also gave us a $500 credit, trade-in credit for each shotgun as well too. So this should be at no expense to the county on this clear trade-in, if the resolution is so passed.
Okay, does anybody have any questions for Jeff? Chief? Hearing none, I'll entertain a motion that we approve item 3.
So moved.
Second.
Is there any discussion? Okay, hearing none, all those in favor indicate by saying aye. Aye. Okay. It's unanimous.
Thank you, Commissioners.
Okay, next item is item number 4, is to request approval to purchase one 2021 Dodge Durango Pursuit V6 all-wheel drive SUV in the amount of $30,789 from Performance Automotive to replace a previously wrecked vehicle with the Sheriff's Office in the detention center. So go ahead, Jeff. I think you got Jason Smiley with you.
I do. I have the Major Smiley with me as well, too, as he assists greatly in the procurement of our vehicles for the Sheriff's Office as well, too. But we are requesting approval to purchase one 2021 Dodge Durango V6 Pursuit rated all-wheel drive SUV in the amount of $30,789 from Performance Automotive. Performance Automotive is listed as one of the vendors through the North Carolina Sheriff's Association Vehicle Procurement Program. And in looking, so when we started looking for, and I can let the Major expand on this, we started to look for vehicles, and unfortunately the market on vehicles, especially police-rated vehicles, is very slim at this point, and with that we were fortunate enough to find that vehicle through Performance Dodge, and seeking approval for that to go ahead and make that purchase to replace the vehicle that was wrecked.
Okay. It's hard to find vehicles, period. I can only imagine what y'all have been having to deal with.
We've been very fortunate this year, working very closely with Mr. Moorhead and Chris Boyd as well, too. We were able to secure our other vehicles for this current fiscal year, and thanks to you as well, too. But fortunately, this was available, and quite surprisingly, so we needed to move forward with it while it was available.
Okay. Did you want to say something, Major? Okay.
Good evening. I will say this vehicle that's replacing it, the one that was totaled by hitting a cow while on a transport with our detention staff, we found the same year model, which all the equipment out of the old vehicle will fit into this one, so it won't cost us an upfit charge as well.
Okay,
So
great.
it was a perfect opportunity to get this vehicle.
Did that collision occur in Haywood County or somewhere else?
I'm sorry.
Did the collision with the cow happen in Haywood County or somewhere else?
It was in Buncombe County coming out of Madison County from a transport late at night. I think it's 2 or 3 o'clock in the morning. Just a black cow.
Yeah, black Angus, that's not good to find one that time of night.
But luckily I was able to find this one.
Did the farmer get his cow replaced?
We never could find that, according to the Highway Patrol.
Nobody ever owns them when they're in the road.
No one claimed that cow.
Yeah, I bet they didn't.
Okay. Does anybody have any questions on that? I always tell my wife, you can't make this stuff up that we do. Okay, I'll entertain a motion. We approve item 4 of the regular agenda.
So moved.
Second.
Any other discussion? All those in favor indicate by saying aye. Aye. Anyone opposed? Okay, it's unanimous.
Thank you.
Thank you, Jeff. And the 5th item is to request approval of a budget amendment from Animal Services for $6,380 to reappropriate remainder of grant funds for the Petco grant that was received in April 2021. The original grant amount was $10,000, of which $3,620 was expended during fiscal year 2021. The remaining balance of the grant was rolled into the fund balance. So go ahead, Howard. That's pretty self-explanatory.
Yes, sir. This came from the Petco grant we received late April 2021. We've expended, as it says here, $3,600. Still have that remaining amount to roll over into the next budget year to continue utilizing towards our microchips that we put in.
Okay. So this is for microchips for the
Yes.
animals? Okay. Well,
The
that's
other
good.
equipment related to it, we bought the scanners already, microchip scanners, and that was the original expenditure we've already put in.
Okay. Does anybody have any questions? Appreciate Petco doing that. Okay, I'll entertain a motion. We approve item 5 of the regular agenda.
So moved.
Second.
Is there any discussion? All in favor say aye. Aye. Okay, anyone opposed? It's unanimous.
I will say for Howard's benefit and for the other commissioners, I talked to several commissioners across the state, and one of the top complaints these commissioners get are surrounding barking dogs. That was a common thing evidently every commissioner has to deal with. Very interesting.
Bring it up.
Yeah. Yeah. Everybody deals with barking dog complaints. It's not just here.
10 times a night. They're my dogs, that's the problem. You haven't had a report on me, have you?
No.
That's good.
Did you check with the sheriff's office too?
It'd be the Waynesville PD that would be out there.
Okay, thank you.
Thank you.
Okay, our next order of business is appointments, but we do not have any tonight. And then the next order of business is a closed session. And as we said, I'll ask for a motion to go into closed session for attorney-client privilege 143-318-11A3.
So moved.
Is there a second?
Second.
Okay, all in favor say aye. Aye. Okay, that's unanimous. We'll be in closed session when we enter the chambers in the back.
Without getting rained on. Just now getting it.